and we will get started. So thank you everyone for joining us. We're glad you're attending this today with us on this very important topic. This is so far within La Crosse County, over 40,000 of the residents have received at least one dose of COVID-19 vaccine. As of 2 weeks ago, 24.1% were Caucasian, while 10.9%, 11.3%, and 6.8% have been American Indian, Asian, and Black, respectively. In recognition of these significant disparities, the state of Wisconsin sought community-based partners to help achieve vaccine equity for all of our residents. For that and many other reasons, Mayo Clinic Health System and Boys and Girls Club of Greater La Crosse announced that they will host a free neighborhood COVID-19 vaccine clinic for adults 18 years and older on Thursdays beginning tomorrow and running through the months of April and May. In collaboration with other community partners, we believe we can make a difference by removing barriers to vaccinations for underserved and underrepresented members of our community. Today, we are hopeful to shed some light and better understand these barriers, addressing potential vaccine confidence issues, and share why clinics like this one can help address health disparities related to COVID and vaccination concerns. We have several community leaders with us today to encourage vaccination for all interested members of our community and offer background regarding potential concerns and barriers to vaccinations. To our media partners, thanks for joining us and taking part in this discussion. I will ask that you can ask your questions to discuss after we ask a few of the questions as we open up this conversation. You can ask your questions via the chat portion of Zoom. Also, you can ask your questions after we get these initial questions done. First, I want to introduce our guests, and please, I will have you introduce yourselves and your title, just for the reporters and for those who are watching, to introduce yourself. So Tony, please, if you would first introduce yourself to everyone.
Okay, well, good afternoon, and thank you for inviting me. My name is Nahua Tony Yang. I'm the president of the Hmong Cultural Center here in La Crosse, and it's great to be part of this. I'm looking forward to discuss about how we can help our community get more vaccines. So looking forward to it. Thank you so much.
Pastor Lockett, if you would please introduce yourself as well.
Good afternoon. I am Mark Lockett. I serve as pastor of Neighborhood City Church in La Crosse.
Thomas, if you would introduce yourself, sir.
Yes, I'm Thomas Harris. I'm the Assistant Director of the Office of Multicultural Student Services here at UWL. And I'm also the guide behind the scenes of the Waking Up White initiative. I'm also part of the Diversity Council as a board member. So just here to really help and put out a good, positive word about trying to get people vaccinated because it's so important. So I'm just glad to be here.
Iola, would you please introduce yourself?
Hi, yes, my name is Iola Stallings. I am retired from Mayo recently. I am a member of the Diversity and Inclusion Council there at Mayo. Thanks for having me.
Arlette, please introduce yourself.
Hi, my name is Arlette. I am the Executive Director for the Greater La Crosse Area Diversity Council, and I am also the Chair for the Coulee Region Immigration Task Force. Thank you for the invitation today. I believe that it's critical that we motivate our communities to vaccinate. There are many misconceptions on the vaccination for COVID. And so I appreciate being in this group today.
Thank you, Arlette. And Dr. Wilker.
Hi, I'm Caroline Wilker. I am a physician of internal medicine at Mayo Clinic Health System. For the past year, I've been working with the COVID frontline care team at Mayo Clinic in the COVID infusion center, and chair the Southwest Wisconsin Equity, Inclusion, and Diversity Committee. I am very grateful to everyone for being here today. Thanks.
So Dr. Wilker, let's start with you since Dr. Shah is unfortunately off on taking care of patients right now and other things. Just from your standpoint, from a Mayo Clinic standpoint, can you just talk about the situation regarding health disparities that you've seen as a provider?
Sure, I for sure don't want to take up the time, so I will give a brief introduction, but making sure all in our community have access to and information about the COVID vaccine is part of our work, is part of our mission, part of our values. COVID has and continues to highlight opportunities to reduce healthcare disparities, and the vaccine has not been different. So early data showing the ongoing need for intention to improving access to the vaccine and vaccine centers, eliminating financial barriers and providing reliable and trustworthy educational information is critical. Very grateful that our community has been included in this and look forward to working with our partners.
Question for, we'll start with Pastor Mark on this from your vantage point as a leader and from your organization. You work with a number of diverse community members. What are you hearing from the folks that you work with on a daily basis about vaccine concerns and maybe just and healthcare disparities as a whole from your perspective?
I appreciate the question. But generally speaking, I think that among, and I don't want to overgeneralize, but I think among the African American community, there has existed some suspicion or concern concerning the vaccine. That's not true across the board, but I have heard some concern about the reliability of it, and coupled with that, the access to it. The church that I pastor is a multi-ethnic church, and given the realities of COVID and how it has prohibited us from meeting as regularly as we would like, I have to be honest with you, I haven't heard a lot of concerns concerning the vaccine. What I've heard is that many of our people have gotten the vaccine. They've shared their response, their body's response to the vaccine, but by and large, majority of the people who attend Neighborhood City Church and people I've interacted with, they are getting the vaccine and they're very pleased to do so.
Tony, let me ask that kind of similar question to you from your standpoint. What's the discussion from your community in the Hmong community?
Sure. Yeah, thank you for the question. I would say with regard to the vaccine in the Hmong community, people wanted it. And so we've been getting calls since, early March about the fact that people want more, vaccines to be available to them. And so we've been getting a lot of calls from the Hmong community. And so I know that people wanted it. Last week or maybe 2 weeks ago, we did a clinic at the Hmong Cultural Center, and we were only able to get a small portions of our population there because of timing and because of the fact that the La Crosse County could only do half a day. So the Hmong community looking forward to getting their family out to get their shots. But I think accessibility is an issue as well, because Hmong people don't know how to access it. The other thing is people were questioning the effectiveness, and also because of language issues, people are not being educated enough about the differences between the three vaccines that we have, like the Pfizer, Moderna to like Johnson and Johnson. So I think that's the, that's what I've been hearing from the Hmong community. And I know that with this clinic that you guys are putting together, I know we're gonna do what we can to get the word out to the Hmong community. And I know that more and more people will come out and get, try to get their family get the vaccine.
Thank you, Tony. Arlette, I would like to ask that same question to you as well, just from your standpoint.
Rick, can you repeat the question, please?
Just basically from your standpoint, in your position, just talk about the vaccine concerns that people face that you speak with on a daily basis.
Yes, I also don't want to overgeneralize, but what we have experienced in working with, and we work closely with the Hispanic community in La Crosse, Trempealeau County mostly, and now we're going to reach out to Vernon County, and we've worked with families in the Monroe County as well. Some people believe that it may not be necessary to be vaccinated because once a lot of people are vaccinated, then it kind of takes that risk away, being that some of the people will be safe, and so that would mean that they will be safe as well and not contracting the virus. That's why I was saying at the beginning about the misconceptions. Now, there are other people that are worried to get sick. They fear that if they get the shot because they have other illnesses that may affect that, to include few people that we know, like diabetes, for example, or maybe even if they have a sedentary life and they don't think that they've been leading a healthy life, they think that the vaccine will affect them. And there's also fear of, and that's pretty much across the board with some of the families that work, that are undocumented, that they don't want to go to the clinics or the points of vaccination because they may think, or they think that they need an ID or a form of identification. So I think those are the misconceptions, and then that's why we are working towards first finding 4 people, and I think we have spotted, and this is just within the Cooley Region Immigration Task Force, 3 people that are going to be our champions with a grant that we received through the Department of Health in Wisconsin, and start educating the families and really sending them so that they can be motivated to get vaccinated.
Super, great information. I'll wrap up my initial questions and then we'll open up to our media colleagues here. Thomas and Iola, if you would, from your perspectives, what barriers from your perspectives need to be broken down to help bridge the gap? Thomas, I'll maybe ask you first, since you work with UWL, you work with a lot of young and college kids there as well. Maybe just from your perspective, kind of maybe if you could answer that question.
When you say bridging the gap with what? Anything in particular? I can't hear you.
I'm sorry. Bridging the gap between healthcare disparities in general, and maybe in particular for this conversation, COVID.
I think for me, I haven't thought about this, but I think because we're dealing with different age situations, on campus, I'm working with college students, which most likely is going to be 18 to 22. you know, and then I'm also working with high school students with some of the diversity work that I'm doing with. And then my college students, you have some that live on campus, some that live off campus. And then you got people who are really traveling back and forth from home, wherever their permanent residencies might be. So dealing with all of that, particularly with the college students, them trying to figure out where can they get the vaccine, where should they get the vaccine at. Usually they're probably communicating with their parents, and their parents are probably telling them one thing, while our campus is probably telling them something else. We have students that I work with who are also employed by the university. I was in a meeting this morning with our care team, and we were talking about the RAs have already been vaccinated. They've already had their vaccine, those kinds of things. The other thing that I think about is just where the locations are and how the information is being communicated across the board. And when I say across the board, there's probably no, what do you want to say? The communication isn't being presented the same way across the board. It's being presented different ways depending on where people are. And I think that that's great that that's happening, but it also can be confusing for some folks. So those are some of the things that come to mind. I would share this. I'm a person that worked in a hospital many, many years ago. One of my first jobs getting out of high school, I worked in surgery. And then I'm also a person who's had a kidney transplant in 2008 by Mayo, matter of fact. And I can say right now, for the folks who are questioning things, you really, really need to get vaccinated. And you need to trust the medical folks, because this is what they do for their living. That's what they do for us as people. And I would say just go on and get the shot, get it as soon as you can, figure out a way to do it, ask questions until you get it. Thank you.
Thank you, sir. And then Iola, from your standpoint?
Well, from my standpoint, I've already been vaccinated, so I feel safe and secure. I've not had any problems at all, you know, in terms of being sick or anything. So I'm 2 months into that shot now. But what I have found is between the ages of 35 and 45, that group of young African Americans that I've spoken with, they're not excited about getting that shot. They are not very trustworthy. There are a lot of things they've talked about in that realm as to why they are not interested in getting the shot. And one of them is a trust issue. And I try to explain to them, show them, first of all, that I've had the shot and I'm living and I'm walking around and I'm feeling good, no problems whatsoever. And I am a senior citizen. So I figure if I'm, you know, a senior citizen and I took it and I'm healthy behind it and I feel comfortable, because what I'm trying to explain to them is that I think if we don't get a handle on it, that it's going to come a time where if you don't have those shots, you will not be able to travel unless you're driving. And then you may not be allowed in the States. It just depends on how under control we can get this thing. And so I'm approaching them from that perspective, and also saying, you know, I'm living proof that you won't die from it. You won't get any kind of, you know, the backlash. If you halfway take care of yourself, you'll survive this thing, and you'll be okay. And just real quick, my catalyst is because I have a really dear friend of mine, and I would say this real quick, that lost her 24-year-old grandson to COVID. And because of that, I felt like it was necessary to not so much protect myself, but others that I might not know have vulnerabilities because of this. And so I try to encourage them from that perspective, that youngsters are getting this thing and they are not surviving. And we need to fix that. And if a shot, 2 shots is all it's going to take for me to help somebody live a fruitful life, take the risk, take a leap, stop being chicken. Get out there and do what you need to do to take care of yourself.
Wonderful words, Iola. I'm going to open it
That's
up
my
to our
piece.
media colleagues now. If you guys have any questions, feel free to jump in right now. Emily or Cade? Emily or Kate, do you have any questions? I have several other ones I can ask and follow up on, but I just wanted to give you up your opportunity first.
In Brazil, what was that, or correct me, Dr. Wilker, if I'm wrong, that the virus can gain more strength. There's people that are not being vaccinated and is spreading. And this is going to affect not just that country, but globally, this is a situation that we need to take care of. So everyone should get a vaccine. We have that privilege here. We should take advantage of that, and to be able to beat this virus, because there are places and there's people that want to be vaccinated, like my mother and many other people that have other illnesses, and if she were to get the virus, she could get really sick or maybe pass. So that's my 2 cents. When we have it here, we have it available, we should get the vaccine.
Thank you, and I apologize. I had an internet interruption on my end, so my apologies. Is there any other questions for media outlets? My apologies.
I can add one more thing too. I know we have the setup here on our campus, on the University of Wisconsin-La Crosse campus at the Cleary Center. So that's offered definitely more opportunities for people on campus and in the community to also get vaccinated. So I think they're doing, I don't know what the actual numbers are, but I hear that the numbers are pretty high on a daily basis. And I think it's mainly been the first two vaccines that require the two shots. And I think at one point they had 100 J&J vaccines. And I was told this morning in the meeting that our doctors is going to communicate with those individuals. And if they have any problems, they're to get in touch with them. So there's going to be a direct link to kind of make sure that there's some communication link there.
Rick.
Yes, sir.
I know that maybe you guys will touch on this a little bit later, but I think the rumors out there in the community and also some of the news also been covering this as well about Johnson & Johnson. And I know that, I got a few call yesterday about, the fact that, people heard on the news that, that the government it's putting a pause on to the Johnson & Johnson. And so I think we need to give people more education about, the vaccines. And I know that particularly, I can speak with regard to the Hmong community because of language issue. And people rely so much on the news, and depending on what kind of news or what source of news that you get, you might have the full, information, or you might not. And so that might play a big part in terms of, people decide to get the vaccine or not to get the vaccine. So I just thought that maybe I mentioned this to the group.
It's a great point. It's a great point. Dr. Wilker, do you have anything to follow up with that on?
Sure. Well, I have a lot to follow up on. I just really am liking to listen today. So I'm hoping to not talk too much, but I think there's a few things I've heard that I really appreciate and would agree with and want to reinforce. First, to Arlette's comment, wholeheartedly agree. We really want to get past this pandemic. Vaccine is the main tool in our toolkit we have. It's a race against the variants right now. And we want to both ensure our community is vaccinated and move to help globally get vaccinated. So I agree with that statement. As far as the different vaccines, absolutely. I think what has been apparent throughout the pandemic, right, is the speed and conflicting information that can come out. And there are many myths as well as absences of optimal education available to people for all the different vaccines. What I can say to the three in general is that we have really adopted the feeling that whatever vaccine is available, please take. Right now, the Johnson & Johnson vaccine is on pause due to some rarely seen complications of blood clots. I think that this demonstrates really the vigilance of safety right now that we are monitoring vaccines with, and not the alternative. So this is science that has been researched for quite some time. I think what a repeated concern I hear from the people I talk to is a concern about how quick this rolled out. And I think that is a common concern about people. And what I try to reassure people with is that really the research has been there for years. We just have finally rolled it out and did so very quickly. You know, we will be on site at the upcoming clinic. There'll be people to answer questions. I think that's helpful. I think the language options are very important. We do have some on our website and through our link. I would love to hear, and maybe this is offline, some better ways to help people get access to the information and education. And yes, right now the Johnson & Johnson vaccine is on pause. That being said, it's temporary. It's being very vigilant and looking at the safety. Members of my family and closest friends have gotten the Johnson & Johnson vaccine. Should it be cleared, I would continue to recommend to do so.
Let me jump in real quick and ask maybe everybody on our panel, and then Pastor Mark and others, this question is the question, everybody always talks about access and accessibility to getting the vaccine. Is that one of the biggest boundaries here locally, or is it more just concern about the vaccine as a whole? Or what is it that might be stopping people from getting it from anybody's perspective?
I would say it's not accessibility in my experience, because it is open to 18 years old and over. Am I right? And you know, I am 48 and I have my first vaccination, so I don't think it's a problem of accessibility. And I know that Mayo is putting up some Mayo and maybe Gunderson, there are going to be some free clinics coming up during the month, April and May.
Anybody else? Their thoughts on that question? Thomas?
I think it depends on your background and where you fit resource wise, you know. So I mean, I don't know what the answer is. So I think about the people who might be homeless or living on the street. I think about the people who are the Salvation Army kind of thing, relating to some of the things that Arlette works with, the people who may be undocumented, you know, what Tony talked about with the language stuff, you know. So depending on one's background and their resources and how they fit into American life, you know, what about the people who have, you know, different kinds of health situations, you know, you got all of these different situational things out there. I think that's where the access is. I'm not sure what it is because I don't work directly with those. That probably needs to be given a little bit more attention, I'm guessing.
Pastor Mark, Iola, Tony, any other thoughts on that from your perspectives?
I think social media could play a big part in helping push this out because social media is playing a large part in them not getting it. I went to a place the other day, and part of the thing is social media is, they just lost DMX. And the thing they brought up about that is with all the information that they had, somewhere it got out that what killed him was he took the COVID shot. And that is what they latch on to. So we've got to be careful or use the same tools that they listen to enlighten them. So if they listen to social media of all the hype of what's not working, somehow we have to figure out a way to use that same social media to get to those individuals that are feeling that they can't take the shot because they can't trust it. Because that's a lot of what I'm understanding and hearing is they don't trust it. And I think it's part of it is because it came out so quickly. The other part is because they're relating it to some things that happened years ago. And, I try to interject as much as I can that, we're wiser now, we're smarter now, we are just as educated, we're more educated than we were at the times when certain things went down, and we have to be more aware of that. And it's a process, and I'm sad that it is a process, but it's a process because there is a group of kids that they're kids to me, that they are not even considering it. And I don't know how to fix it. I don't know, but I try and say, I'm living proof it works. It won't kill you. It won't take you out. You'll still be here. And now you'll be vaccinated and hopefully safe for you and the rest of your family. I don't know. Social media is a place we start, I think.
Pastor Mark, it looks like you might be thinking about something there.
I to piggyback off what Iola was sharing, I really don't know how you overcome the challenge with communication and what has been persistent, since we became aware of COVID on our shores is the communication of the illness, and now that the vaccine is available, we're continuing to deal with the challenge of competing narratives and misinformation and things like that. So I see that as the obviously I don't know the answer, but I see that as the greater challenge that is facing the community. How can there be one authoritative voice that instills confidence in the broader community? How that happens, I do not know.
And that's where it's a great lead into my next question. And let me ask one more time, Emily or Kate, do you have any follow-up questions or any questions that you would like to jump in here?
Not at the moment.
Okay, Kate? Well, let me ask you this all real quick as a quick follow-up, and maybe we wrap it up on this question. So you make a great point, Pastor Mark, in regards to, looking to people for leadership and looking up to folks. So if we could ask you each of you from your perspectives, what would be your message to the communities you work with on a daily basis, or just the community as a whole regarding COVID and COVID vaccinations? Regarding getting the vaccinations as a whole, maybe kind of speak from your perspective, from the heart, from your positions, from the people you talk to on a daily basis. Like I said before, what would you say to them about the vaccinations as a whole? Let me start with Tony. I'll start with Tony since I've got him on my screen here.
Yes, thank you for the question. Again, I think my message to the Hmong community as well as all the Asian community and to our community is that we all been waiting for some kind of a vaccination, and now that they're here, I don't want to make decisions for people, but we're here to help people, and if people have any doubts about any vaccination, call our agency. It will be able to help them connect to a professional like you guys, and maybe help them make the decision. But I would say though that for the Hmong community, like about 2 weeks ago, we did have the clinic at the Hmong Culture Center, and we gave out about 300 plus shots of Johnson & Johnson. And then because of the news, I heard about the pause. So I start calling some of those families just to find out, how they're feeling, how they're doing. And most of them took it pretty well. Most of them said, I have no symptoms. My family's doing well. We were happy that we got the shots. So I would tell people that if people would have asked me, right? So the federal government wrote out about what, maybe 7 million, shots of Johnson & Johnson. And there are like 1 death and 5 or 6 people that have symptoms, so yeah. So anytime when you do stuff like this, I mean, you're gonna run into some minor stuff like this. But I would encourage people to ask questions, continue to ask questions, get educated, and get vaccinated. That's what I would say to my community.
Pastor Mark, let me go to you. Your thoughts and maybe your final message to everyone.
Well, I would just say that it's important to hear the concerns of the people and to be sympathetic to challenges that they deal with, concerning credibility and things like that. But I think that my overarching message would be that there has to be some goodwill, and just hearing from Dr. Wilker today instills within me confidence that I can communicate to those people with whom I have a bit of influence, and just encourage them that if they have concerns about the vaccines, any 3 of them, that they can be confident in taking those vaccines, and that they should take those vaccines. And so that would be my message to them.
Thank you, sir. Arlette, your thoughts from your perspective.
My message would be to really think about asking questions to people that you know, to your doctor if you have a doctor. Discuss those questions with people that are close to you. Talk to people that have been vaccinated, and really going deep into the answers of why you wouldn't want to get the vaccine, and also making sure that you know the benefits of everyone being vaccinated. I guess that would be my message.
Thank you, Arlette. Thomas, Mr. Harris, sir, your thoughts, your final thoughts.
Yeah, the thing that I would add is, I noticed, listening to some of the students that I'm connected with, they've been talking about house by house. So that makes me think of family by family. If we could work that way and think that way and try to have everybody in a particular household to be vaccinated and to be talking to one another, that would be great. And because the idea is not to only protect yourself, but to protect others. I also think that kind of like what I said before, there's got to be some level of trust, knowing that everybody in the world is looking forward, or most people are looking forward to getting this vaccine. So I'm hoping that each individual could look at it that way and say, there must be something good about this, and there must be something better than just wearing the mask and keeping your hands clean. I'm not saying that we should stop doing that, because that needs to continue, but let's add this other thing that we were hoping for a year ago, and take advantage of that. That would be my last word. And I would say that I did get both of my shots. Yeah, I didn't mention that too. So I'm good to go.
That's good to hear. Iola, your thoughts. I'd like to hear from your perspective to help us wrap this up.
Mainly just, it's not about you, it's about the people that you love and that are around you. And I would hate to think that by not getting a shot, I could be a carrier and might act, not on purpose, but make somebody else sick because I thought, you know, oh, I don't want to get the shot. It's not about us anymore. We got to think about others, the people that we love. It's very important.
Dr. Wilker, I'll give you the last words from your perspective as a physician and hearing all these wonderful words from everyone.
Yeah, I'm moved by this group and I'm grateful to our community here and in La Crosse. I will, really reiterate that one thing that has been learned this past year is that teamwork and community involvement is very helpful. So I appreciate everyone being here today to discuss this. I speak, I'm sure, on behalf of my profession and absolutely on Mayo Clinic to encourage people to reach out. We really want to make this available for everyone who wants it, and we want to answer all questions for people who have them. So if I can help with that, please reach out to me and us, and thank you all. We are on the precipice of this being over, and we all want it to be over, and this is the main tool we have to get there. So
I agree.
thank you.
I totally 100% agree. And a couple of things to wrap this up. And again, for everybody who's interested, we have our vaccination clinic. We know Gunderson Health System has their vaccination clinic. There are several other locations that get your vaccination, including at UWL. And of course, as we've been talking at the very beginning, we're opening up this vaccination clinics at the Boys and Girls Club starting tomorrow. They'll be at both Boys and Girls Clubs locations. There is registration. Please do call Boys and Girls Club. They will get you registered and you can come in and get your vaccinations. We will take care of you at those locations. But most importantly, for everyone in our community, please get vaccinated. Please take advantage of any place you can get the vaccination. We would greatly appreciate that for everyone's health and concerns. We could probably have this conversation for several hours, but we're going to wrap this up for time constraints and everyone. I want to appreciate to everyone. Thank you everyone for taking your time out, for taking part in this wonderful conversation. A conversation I'm sure that will continue for days and months and probably years to come. So, but again, thank you to all. Greatly appreciate your time, and thank you and have a good day.
Thank you, everyone.
Thank you so much.
Thank you.
Thank you.
Nice seeing you, Iola.
Yeah, thank you,
Good
everyone.
seeing you too.
Enjoy
See you
going
soon.
back to retirement. Thank you.